I'm a cell biologist, and I've got a PhD on pharmacology at the University of Milan. And we recently run a new center. It's a center for regenerative medicine called Regain, where we actually try to combine our background in science with the clinical application of these orthobiologics in the musculoskeletal field. Lipogems is a micro-fragmented adipose tissue. That means that we preserve the microarchitecture of the tissue, and so the cells are in their natural, their physiological environment. And in this way, the cells are able to work together with all the other components of adipose tissue, which is the pericytes, which are not MSCs, or other cells of the extracellular matrix and molecules. And so the main therapeutic effect of lipogems is actually is driven by the cells, the pericytes, which we can also call MSCs, and they sense the environment and they release accordingly a plethora of different molecules with different effects, which mainly are trophic immunomodulatory effects. And in this way they start a crosstalk with the resident cells, and altogether they promote the restoration of the tissue homeostasis which has been lost because of the disease. So that's the main mechanism of action of lipogems. So although I'm not a surgeon, I try to support the clinicians in developing their algorithm of treatment, and we now patients with osteoarthritis. Lipogems is not the first line treatment, of course, so all our patients before coming to our attention, they already had some traditional conservative treatment, including very often a cycle of anti-inflammatory drugs. And when they are not responding to this, the first thing we encourage the patient to try is the PRP injection. So we have different PRP, and the surgeon usually choose the one they think could be the best one for that given indication. And then when the PRP injections are not effective, or when we see that the effectiveness is too short, that means that the severity of the disease is too high, then we suggest the patient to undergo a lipogems treatment. Because of its ease of use and its a smart way to be produced, I think it will be for a long time on the stage. However, I think that the next generation approaches will be based on secretome, which is actually the whole complex of molecules that are released from cells. So the cells secrete these molecules, and it's called secretome. And this secretome can be prepared in the lab because we can precondition the cells, and this means that we can somehow force the cells to produce what we want in a higher concentration. And using this secretome in the patient would be, of course, very advantageous, because we would not have any need for harvest tissue. The patient would just receive this injection, which is an off-the-shelf product, contain the potential of the cells. That's one of the probably next generation regenerative medicine approach. And of course, adipose tissue will still be protagonist, because the cells from adipose tissue seems to be the one with the highest secretory profile.